Today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Nurse Jamie Charles, Head Nurse at the Cuba Hospital and Multi-Training Facility. I am Candice Alcantara, Manager Corporate Communication for the Ministry of Health, and I will moderate this morning. We go to the CMO for the clinical update.
Hi, good morning, Ms. Alcantara. Good morning to the Honorable Minister. Good morning to Nurse Charles, members of the media, members of the viewing and listening public. So we'll begin with the dashboard for the 4th of February, 2022. So I'll leave the portion with vaccination status off. Honorable Minister will go into details. And we begin with the new positive cases over the last 24 hours, 581. Total patients hospitalized, 452, and that is in both step-down as well as quarantine, step-down and hospitals. Deaths reported over the last 24 hours, 15, and condolences to the families of all of those who would have lost loved ones during the pandemic. Total active positive cases so far, 19,844. And if we look at the patients by vaccination status in the pie chart, looking at the green section, 15.9 and 84.1 related. The green portion, fully vaccinated, 2,301. Not fully vaccinated, 12,164. And this is for the period July 22nd, 2021 to 19th of January 2022. And again, patients in hospital and step-down facilities. If we look at the deaths by vaccination status as of the 3rd of February 2022, the bottom bar, which is the grey portion, plus the blue portion, accounts for those who are not fully vaccinated, 2,827 and 390. The little green bar above it, 216, are those fully vaccinated. And just to underscore, in Trinidad, upwards of there's a 15-time greater risk of dying from COVID-19 if you are not fully vaccinated. If I could have my first slide of the next presentation, please. So the other presentation will go into some detail as to an updated COVID-19 discharge criteria for those in isolation. So if we could go forward. So just to underscore what is the difference between quarantine and isolation. Quarantine is the restriction of activities and or the separation of persons who are not ill, but who may have been exposed to a person with confirmed or a probable SARS-CoV-2 infection. Isolation, on the other hand, is the separation of persons with known infection to prevent the spread of the virus. Go forward, next slide please. So, our discharge criteria for home quarantine. Just to remind, the discharge for the quarantine again is for persons who would have been exposed without symptoms. Those are primary contacts, secondary contacts, and the like. Persons in self-quarantine at home will continue to be officially discharged 14 days after the day they were exposed to a suspected or confirmed case, once they continue to display no symptoms. If symptoms do develop, please notify your CMOH immediately, and arrangements will be made for COVID-19 testing thereafter. Next slide. So what has changed is the discharge criteria for home isolation and for isolation in general. And we broke it down into two broad categories. And this is based on the data supported or sent in to me and supported by local and international data, as well as vaccination coverage in the country. So we are seeing now asymptomatic cases. Persons will be discharged after 10 days from the date at which the positive sample was taken. So that is persons who never had symptoms at all. A common example that you find is somebody having a positive as they take a test for the purposes of travel. They have no symptoms. You'll be followed for 10 days, and once that 10-day elapses and you have no other concerns beyond that, meaning development of symptoms, you'll be discharged after 10 days. Next slide. So for symptomatic cases, and this goes from mild cases all the way up to severe cases, persons will be discharged, and we're looking at a minimum of 10 days after they first had symptoms, and we're adding 3 days where they don't have any symptoms of the acute symptoms. And in the next slide, I'll show what I mean by acute symptoms, because sometimes, as we had stressed last week and the week before on long COVID, you see that certain symptoms persist for a very long period of time. For example, shortness of breath, fatigue, and other symptoms. We are looking at the absence of acute symptoms in the presence, or the absence, of medication. Next slide. So if you develop acute symptoms during the quarantine period, you will be swabbed and treated. And common symptoms for acute infection, which we'll be looking at for prior to discharge, will be cough, fever, runny nose, also called rhinorrhea. Those are the three main ones, but there will be some discretion at the level of the CMOH. If they think there's a hint of the acute symptoms continuing, they will make that decision when they look at that 3-day period where they have to add on to the 10 days. Next slide. So we continue to emphasize the importance of getting all recommended vaccine doses, including a booster, when it is your turn to have it. And next slide will just focus on, if you could go forward, please. The last slide will just give you, as always, the 3 W's. Wearing your mask, which is essential to cover your nose, mouth, and chin, wearing appropriately at all points in time, watching your distance, and washing your hands, especially if you top objects that might be soiled. For example, even in the workplace, you're looking at handling files, or in any other space where you're touching fomites, for example, doorknobs, etc. So thank you, Ms. Alcantara. That's the update for this morning.
Thank you very much, CMO, for especially reminding us about the 3 W's. Those are consistent things that we need to continue to follow. And we go now to Nurse Jamie Charles, who will speak on the impact that long COVID is having on patients and the treatment and care that are being provided by our dedicated nursing team.
Good morning, ladies and gentlemen. All protocols observed. I am Jamie Charles, a head nurse employed by the NCRHA at the Couva Medical and Multi-Training Facility. I have been working with COVID patients for nearly 2 years and have been a practicing registered nurse for the past 12 years. As part of my country's response to the COVID-19 pandemic, I was initially posted at the Arima General Hospital to assist in the management of suspect and confirmed COVID patients. However, in April of last year, I was reassigned to CMMF along with several of my colleagues, where we have been since. Today, I am pleased to share a glimpse of what patients experience while warded at the nation's quarantine facilities. And it is my hope that this presentation can encourage at least one unvaccinated person to get vaccinated. There is no doubt that patients and their loved ones face uncertainty when admitted to the nation's quarantine facilities after being infected with the SARS-CoV-2 virus. They feel stripped of their independence, freedom of movement, and even the physical touch they would normally receive from their loved ones at home. They aren't allowed visiting hours and are usually confined to their bed. Those who recover are sometimes faced with a debilitating group of symptoms known as long COVID syndrome. Long COVID, as defined by the WHO, is a group of symptoms that some persons experience after they have recovered from COVID-19. Some of the common symptoms patients experience include shortness of breath, cognitive dysfunction, also known as brain fog, fatigue, chest pain, muscle pain, difficulty sleeping, and anxiety. The duration of these symptoms is not completely clear. Treatment by a multidisciplinary team, which includes a primary care physician, mental health professionals, and other specialist physicians, is needed. At the Arima General Hospital, the Executive Wellness Clinic has been operating just after the commencement of this country's COVID-19 pandemic response to alleviate the clinical burden of long COVID sufferers. The EWC provides these patients with the necessary aftercare to deal with their daily lives. It comprises of nursing staff, junior medical officers, specialist medical officers such as internal medicine, nephrology, cardiology, and thoracic medicine, etc., medical social workers, physiotherapists, and pharmacists. Additionally, some of these patients may access psychiatric services, whether by clinical or self-referral. This multidisciplinary approach is carried out in order to get patients back to their regular lives as quickly as possible. It is of utmost importance to understand that the sufferers of long COVID can be both hospitalized and non-hospitalized infections. One must appreciate that this includes those who are either asymptomatic or have very low symptomaticity. Where I work, we have had many patients battling this disease for longer than their expected quarantine period. The vast majority of them are sometimes afflicted by a multitude of comorbidities ranging from chronic disease, cancer, mental illness, gynecological or obstetric illness, social issues, etc. While they are warded and when they are seen in subsequent clinics, this same multidisciplinary approach is applied. Yes, there are instances when certain medical specialties may not be immediately available to COVID-19 patients while they are under state quarantine. However, they are referred upon discharge and at the end of their quarantine. As part of the nursing team at the Couva Hospital, my team, with the support and guidance from senior management, spare no effort in ensuring our patients receive the best possible care offered and spread a little cheer and positivity. So here I would like to show you a few slides of some of my team donned in their PPE who have gone the extra mile to put a smile on the faces of their patients. Can I have slide 2 and slide 3? While I can easily say the NCRHA has put an army together to wage war against this virus, I must make my position clear. Preventing COVID-19 infection is the best way of preventing the development of post-COVID-19 symptoms or long COVID. Therefore, vaccination along with social distancing, regular hand washing, sanitizing, and mask wearing reduces the risk of infection, hospitalization, and mortality by a significant number. I would like to encourage and plead with all citizens who are currently unvaccinated to make the right choice. The fact remains that the percentage of unvaccinated persons at the nation's quarantine facilities immensely outnumber their vaccinated counterparts. While many of us crave freedom from restrictions, consider this. I have seen every creed, race and age and socioeconomic class fall victim to this deadly virus. Vaccines can provide us with a crucial component in the fight against COVID-19. While many of you remain hesitant, I urge you to empower yourself with facts, knowledge, and relatable information about vaccines and stay clear from misguided persons and misinformation. It is often seen that health is not valued until sickness comes. So please value your health and get vaccinated today.
Thank you very much, Nurse Charles, and we do appreciate your perspective as someone who works directly in the midst of COVID-19. We go to the final presentation this morning, which comes from the Honorable Terence Dayal Singh, Minister of Health.
Thank you very much, Candice. Good morning to CMO, Dr. Parasram. A very special welcome to Nurse Jamie Charles. And I really want to salute you and your nursing colleagues throughout the country for your dedication to duty over the past 2 years. Not only nursing, but every single category of healthcare workers. Thank you very, very much. Ladies and gentlemen of the media, good morning. And members of the public who are listening, good morning, good Saturday morning to you. Today is Saturday, the 5th of February, I believe. Let me give you the vaccination numbers at the close of last night. Those who are fully vaccinated, 694,625. So we are inching up to that sort of magical number of 700,000, which will represent 50% of our population, which is not a bad target to hit, and then we press on. But we are moving to it very, very slowly. So that's 49.6% of the population fully vaccinated. Our booster program so far has yielded 114,938 persons. And as you know, we started our booster program 2 months ago. And we are coming to the end of month 2. So part of my job here this morning is to roll out month 3 of the booster program. So if we could have that slide, please, on the booster program, I would appreciate it. So the booster program will continue. For those who receive, yes, that's it. For those who receive their AstraZeneca doses between the 1st and 7th of August, you can now come in to get boosted between the 7th and 12th of February. So the 7th is Monday, I believe, Candice? Yes. If you received it between the 8th and 14th of August, you come in between the 14th to 19th of February. If you receive between the 15th to 21st of August, you come in between the 21st to 26th of February. And if you got it between the 22nd and 28th of August, you come in between the 28th of February to the 5th of March. As usual, this will be posted up on our Ministry of Health website from today, I believe. It will be on social media and also print media. Similar sort of schedule if you receive your Sinopharm doses. So no need to go into the details again, but basically, if you receive your Sinopharm between the 1st of August to the 20th of August, you come in between the 7th of February to the 5th of March. The dates are there. Similar sort of procedure for Johnson & Johnson. Anyone who got their Johnson & Johnson shots, so the Johnson & Johnson is slightly different, so let's go it through. Johnson & Johnson, 8th to 17th of December, if you received your shot then, you come in between the 8th to 12th of February, so that's from next week, Tuesday. If you got J&J between the 18th to 24th of December, which would have been Christmas Eve, you come in between the 14th to the 19th of February. And if you receive J&J from the 28th of December to the 7th of January, come in between the 21st of February to the 26th of February. And if you receive J&J from 8th of January to 14th of January, come in from the 28th of February to the 5th of March. So slight differences there. Pfizer, as we indicated, Pfizer boosters will start in March of 2022. So the Pfizer booster program, for those who got Pfizer, that will be in month 4 of the booster program. As you know, the booster that you can get or request will be any of the vaccines available. WHO changed the policy a couple of months ago. So regardless of which vaccine you got, you can get any of the available vaccines as a booster. It is no longer like for like. Our COVID-19 vaccine booster locations, as they are there as usual. On the northwest, the Paddock, Hazley Crawford Stadium, ERHA, Sangre Grande Civic Center, Hansrad Simir Singh Multipurpose Complex, Rio Claro, Bayaro Sport Facility. On the north central RHA, Costa El Dorado, Larry Gomes Stadium, UTT Campus, Monroe Road. On the southwest, Sapa, Point Fortin, Southwest Regional Indoor Sporting Arena, DB Health Center. And for Tobago, Scarborough Health Center, Keenan Health Center, Roxborough Health Center, and the Port Mall. So we are urging people to come in for their boosters. As the CMO will tell you, and all the experts in this field, one of the best way of protecting yourself against the Omicron variant, which has been shown worldwide, one of the most effective measures is to get your boosters. And let's not get too complacent with the numbers that we are getting these days. Yes, the numbers are going down. Yes, the number of deaths are going down, but we are still unhappy with the number of deaths. And why? Because so many of deaths could have been avoided if people were just vaccinated. As the CMO and Dr. Hines will tell you, you stand a 14 to 15 times greater chance of dying if you are unvaccinated. So think about it. If we record 15 deaths in a day, that could be CMO 1 or 2 if people were vaccinated. Think about how much better we could be doing if we got vaccinated. So we continue to make vaccines available. The vaccines are safe, as you have seen around the world. The vaccines really, really do prevent you from getting severe illness, from going into an ICU. And it really, really can help bring down these deaths, because too many people are still dying who are unvaccinated. So we keep on asking people to listen to the science, act in your own self-interest, don't pay attention to social media, and those who don't have your best interest at heart, and simply get vaccinated. Thank you very much, Candice.
Thank you very much, Minister. And we go now into the question and answer segment. I invite our media representatives to indicate your name and the name of the media house that you represent before posing no more than 2 questions in the first instance. We ask that you pose both questions at the same time, and our panelists will try to respond. Please make your questions as concise as possible. And if time allows, we will come back to you for additional questions. Again, please make your questions as concise as possible. We begin this morning with AZP News.
Good morning, Private Harry, AZP News. Good morning to everyone. My first question is CMO. CMO, we have a case of a parent who has a child that will turn 12 at the middle of the month. So if he gets his first Pfizer, when it's time for the second Pfizer, it'll be after this batch of vaccines has expired. So I don't know if the policy is that such people should still take a first dose of the Pfizer. Sure. And second question, the Minister, can we get a breakdown of the number of vaccines in terms of brands that have been administered since the start? Thank you.
Yeah, so basically, as you know, when we would have announced the Pfizer donation from the United States, it was supposed to be in 3 tranches. So we had received 2 tranches thus far. We have a meeting, I think, scheduled for Monday with Washington, the head office. So coming out of those meetings, we will know exactly what is happening with the 3rd tranche of vaccines. We do have Pfizer with an expiry up to the end of February for now, and we will make the necessary announcements once we conclude that meeting on Monday.
Yeah, and prior to your question about vaccines given out by brand, I don't have that breakdown with me, but as we have consistently said, Sinopharm is by far the most popular brand in Trinidad and Tobago, most accepted, most widely available, but we will try and get that if I could. Thank you very much.
Thank you very much. We go now to Newsday, please. We're ready for you at this time. Newsday.
Hi, morning. Quinn Chantak of Newsday. My 2 questions are, firstly, to anyone on the panel, can anybody confirm whether a claim made by tutor earlier this week about 20 teachers dying on duty at school happened in the last year, and these were COVID-related deaths? And on the basis of that, how safe is it exactly to look to be expanding the move to bring back to have more in-person classes in school from, I believe it's next week? And secondly, I'd like to find out if it is that the ministry is satisfied about the level of safeguards which are in place to prevent infection or possible transmission at any of these upcoming Taste of Carnival events. Thanks.
Yeah. So thanks. So I will take both questions. So we have no hard evidence to show that any number of people who died would have contracted the disease in any particular place of work. We have no hard evidence of that. The other issue about opening up of schools, as I have said publicly, and we have said publicly, whenever you open up any part of the society or the economy, there will be risks. But at this stage, when vaccines are so readily available, you would notice that countries are placing more and more of the responsibility for the response to COVID on the population. Countries are not taking the position that we could cocoon and shut down and lock down things forever. It just is not good economic sense, mental health sense, socio-economic sense. And I have said publicly that I support the reopening of schools. Our children need to be out there, learning, playing, moving, meeting their peers, socializing, getting their nutrition. The benefits far, far outweigh the risks. And the onus is on all of us to protect those who cannot be vaccinated by becoming vaccinated. So we encourage all sectors to get vaccinated. And the same applies for the Taste of Carnival issue. We are in full support of the Ministry of Tourism, Culture and the Arts to start to reopen the entertainment sector as carefully as possible as they are doing. And again, whatever risks there are will be mitigated by the fact, and we are happy with this, that I almost said patients, that patrons coming into these events are going to be fully vaccinated. So the overarching message is whatever industry, whatever sector of the economy you belong to, the major responsibility now for the response to COVID-19, and we have been saying this since last year. If you check back to earlier press conferences, we have been saying this consistently. The responsibility has shifted dramatically from government action and government intervention to personal responsibility for the 3 Ws and getting vaccinated. Thank you very much, Clint.
Thank you very much, Minister. TV6, we are ready for your questions now, please. TV6, let's go to you.
Good morning. Question to the Health Minister. As you mentioned, a taste of carnival. I'm just wondering, depending on the COVID-19 numbers at a particular point in time later on in the year, for example, and the availability of technology, like let's say QR code type technology with vaccination information, could that possibly allow at some further point later on in the year the return of events that are not necessarily allowed right now in terms of the taste of carnival concept, for example, FET's large events? Is that a possibility later on with those conditions being met?
Okay.
And secondly, right, Mike, that's the first question.
Sorry, go ahead, Joel.
That's all right. Secondly, any update in terms of the proposed plan for the public sector in terms of what had been a version of the safe zones concept in the private sector for the public sector? Any update on that right now, sir?
Yeah, thanks, Joel. So I'll take both questions. So let's deal with question one. Further reopening. Let's wait until we reach that bridge. I can't predict what the future will bring at this point in time, but we are taking very brave measures to open up as many sectors of the society as possible, especially to those who are vaccinated. So for large-scale events that you spoke about, we don't have a position on that as yet, but let's wait and see what happens with the numbers. On the issue of the quasi-safe zones, as you know, the Honorable Attorney General is meeting and treating with the stakeholders on that. And if there's any position to be announced, that will come from the Honorable Attorney General. Thank you very much.
Thank you very much, Minister. I see that AZP News has a follow-up question. So if we can please go to AZP News.
Yes, good morning again. CMO, I just wanted to follow up. So if a child turns 12 at the end of this month, should he take the vaccine or should he wait until we get the third batch of the Pfizer?
No, so certainly if we, as I said, if we have that meeting on Monday and we let everyone know what's happening, we will know if we are getting a third tranche and what will be the expiry of that third tranche, and then we'll be in a better position to advise the population thereafter. So let us have the meeting first, and then we can give some advice.
Thank you very much, CMO. And I don't think we have any other. Oh, I do see a follow-up from TV6. My apologies. Let's go to TV6's follow-up question, please.
Yes, thanks again. Just wondering, in terms of the person who had been identified as the person who brought in the Omicron variant, any update in terms of that situation? And also, as well, in safe zones, let's say those that allow for those under the age of 18 to attend, like cinemas, for example, if the those children, for example, are unvaccinated, but they are vaccinated, but they may not have like photo IDs, for example. How do the owners of those safe zones deal with that issue, since I think, if I'm not mistaken, you need the vaccination card and photo identification?
Yeah, thanks. So the update on the Omicron, on the patient 0, patient 1, the index case on the Omicron variant, I don't know if you're referring to the police part of it, but I can't speak to the police part of it, but that person will be out of quarantine, CMO, a while now. On the safe zone for cinemas, I think the cinemas have been fairly flexible in what they ask for and what they determine is appropriate ID for those children without photo IDs. And I haven't heard of any problems with it. So I think there's a degree of flexibility being applied there. Thank you, Joel.
Thank you. Let's go to Newsday, Mr. Chantak. Let's go to Newsday, please.
Hello again. Okay, well, my follow-up question is, well, continuing along one of the trends that Joel's raised there, as part of the whole opening up concept, and we see that other countries are now relaxing a lot of things, including travel restrictions and inflows and outflows. So how are we in terms of our safeguards and border protocols to prevent anything from coming in or reduce the amount of things coming in? And are we thinking of doing any types of similar openings regarding our border control aspect of COVID-19 based on what we see happening elsewhere?
Thank you, Clint. So I don't know what specifically you are talking about, but we opened our borders since July of last year, I believe, to vaccinated, to two categories of persons, citizens and residents, I believe. If you are to both vaccinated and unvaccinated, vaccinated you go home, unvaccinated you go into quarantine, state supervised. For non-nationals, you have to be vaccinated, and that has been in place since July of last year. So we were quite early in that. I see other countries. And you see, it's not a race to be number one in this thing. Every country has to make a decision based on their own epidemiology and based on their own circumstance. So it's not that one country is first, one country is second, one country is better, one country is not better. All countries are making these very difficult decisions based on their own local circumstance, and we continue to monitor our local circumstance, but also pay attention to what is happening regionally and globally, and if any adjustment is to be made to all those protocols. As we always say, the Honorable Prime Minister is informed, the decision is made, and Ministry of National Security and Ministry of Health will meet on it and inform and advise, and a decision will be announced if the need arises.
Thank you very much. TV6, we go back to you again at this time. TV6, please.
Very quickly, Minister, thank you very much for taking the call. Trying to just not answer call, just I'm sorry about that. Just in terms of two things very quickly. One,
sorry, Mr. Brown, can you raise your volume of your voice just a tad? We're having a little
All right, I apologize. You're hearing me now?
Much better. Thank you so much.
All right. Thank you. In terms of two things, Minister, the issue of, I think, QR code type technology in terms of, or some sort of card type technology for the vaccination information. Is there an update on that? And also in terms of the kind of rapid tests that would have heard of, let's say abroad, for example, that persons may do at home, that kind of thing. Is that also something? I know you may have spoken about it before, But is there an update or not in terms of approvals for both of those things?
Thanks, Joel. So, I had a meeting, as I promised last time I was here, with Minister Bacchus. What we are doing now, we are in the final stages of data verification by actually calling, when we look at the data, actually calling people to verify their data. And he has assured me once that part of the exercise is finished, we should be closer to launching. So we are in the final stages of what is called data verification. On the issue of rapid tests have been approved a while ago, and we sent out a press release maybe about a month ago, detailing all the brands that were available for rapid tests that were approved by Chemistry, Food and Drugs, and people are using it. But I would like the CMO just to talk about the do's and don'ts, advantages and disadvantages of home rapid tests. Yeah, thanks.
Yeah, so generally speaking, when we talk about rapid tests, I think people are speaking generally about an antigen test. So the PCR test is distinguished because it's actually checking a very specific portion of the spike protein in most instances, and it's very sensitive and very specific. With the antigen test, on the other hand, the sensitivity and specificity varies depending on the type, meaning the manufacturer, the quality, the way the sample is taken as well, and the storage conditions. So, for example, using home tests, you would expect that it would not be performed in a lab one, and it would not be performed by a professional person taking the test. It's a home test, so it is prone to inefficiencies. And just to add, in terms of the sensitivity and the specificity, the recent research has suggested that on the face of Omicron, in particular, the antigen tests have the sensitivity and specificity has dropped significantly in the face of this variant of concern because of the large number of mutations. So be cautious with your antigen tests. Back it up. We still advise to do a PCR test if it is positive as a confirmatory test and you have persistent symptoms. But the best place to use these tests, which we are using in the public system, it's the antigen F and the antigen Q for persons who have symptomatic disease and other persons where we have the availability of PCR to do us a confirmatory test if need be.
CMO, if I could ask, just explain to lay people like myself and everybody else what sensitivity and specificity means, please.
So it basically just the easiest way possible is really to detect if someone is really positive, meaning that a positive person actually has disease, and the other one is if a person who doesn't have the disease is showing up negative on the test. So it's a gauge of how well a test can actually pick up what is actually there in the person. So a positive person being able to be picked up as positive, and a negative person being able to be detected as negative.
So I am going to play media here now. So should it be used, and Joel raised an important point, so please forgive me for harping on it. Should it be used by the asymptomatic person or the symptomatic person?
So again, it depends on the type that we have. So in terms of the best use would be with a person that has symptoms, especially on the back of our large surge of Omicron. So what you see in the population is a high level of virus circulating. So you tend to pick up a lot of the cases more readily. When you do a test with an antigen, it gives you something called a probable positive. If you have no test at all, you're suspected. Do an antigen test, it goes to probable. If you do the PCR, it confirms the diagnosis. So that is the way it flows. But again, it's best to use with people that have symptoms. But there's a place and a time to use it without symptoms. But the best place usually is within an institution where we can verify quickly, either way.
Thank you very much. And as we give the media representatives a little time, I think AZP News, did you still have a follow-up question? Okay, let's go to AZP News, please.
Good morning again. My question is for Nurse Charles. Nurse Charles, would you say that you see long COVID more in patients who have pre-existing conditions, and should a long COVID patient still take a vaccine? Thank you.
And so we'll go to the nurse to respond to that.
Thank you. So we do see a lot of patients in the hospital with premorbid conditions like diabetes, high blood pressure, renal disease, and what have you. Once those persons are cleared by the medical officers, they can take a vaccine within 3 months after infection.
Thank you very much, Nurse Charles. Let's go now to, I see CNC3. CNC3 is with us. Let's go to CNC3, please.
Hi, good morning. Sweeney Gray from CNC3. I just wanted to confirm, because someone is messaging and asking for clarity on the new quarantine times for persons who've tested positive or persons who are coming in from away, if there's been any adjustment on that. And two, this week on social media, we saw a lot of people sharing alleged reports of fake vaccination cards on sale. So if we can just get an update on if the ministry has been having to share information with the Ministry of National Security with those alleged reports, and what has the communication been from the Ministry of NatSec on that?
Yeah,
Thanks so much.
Yeah, so I will take the issue of the vaccination cards. Whenever these reports surface through the Chief Medical Officer and his interministerial team, where a representative of the TTPS sits, we send all those reports to the TTPS for their investigation. What we would like, if anybody has firm information, because sometimes a lot of these, you know how social media is, lots of allegations. But if you have firm information or allegation, especially with a name and a phone number, send it to us in confidence, and we will send it across to the TTPS, and let's work together on that issue. CMO?
Yeah, so in terms of the quarantine period, as I said in my presentation earlier, the quarantine period being a period from when you are exposed to a positive or suspected case, that remains the same 14 days as it aligns to the incubation period of the virus, and none of them have shown any significant variance in terms of that incubation period. In terms of the, as Minister discussed already, the policy for entry remains the same as well at this point in time.
Thank you very much, and we have no more questions from the media. But as you know, I try to encourage persons on a weekend, please go get vaccinated. We have locations open until 3 p.m. You can go to the Paddock Queen's Park Savannah right now. You can go to Costat El Dorado, and they close at 3 as well. The Larry Gomes Stadium, you can walk in and drive into Larry Gomes Stadium. Sapa is opened until 12. So that's closed today, my apologies. UTT Shogunas campus is open right now until 3 p.m. And tomorrow, you can go to the Larry Gomes Stadium. Again, you can walk in or drive through. Make it a fun affair and protect yourself and your family. Thank you, everyone, for joining us and all who participated. Minister, CMO, and first time we had Ms. Charles, members of the media, and of course the production team, the sign language interpreters, and our viewing audience. Remember that we all have an important role to play in protecting Trinidad and Tobago from COVID-19. Get vaccinated, and please keep playing your part. Follow the health guidelines, especially social distancing, washing your hands, sanitizing, and wearing your masks. Everyone have a good day and be safe.
I'm from Borneo Garden, Saruka, and I am fully vaccinated. I chose to get vaccinated because I suffer from asthma and I was really concerned about my health during the pandemic. I encourage others to get vaccinated because your health is important and you should do what you need to do to preserve your life.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Good day, guys. My name is Roshan, born and raised in Santa Cruz. I recently got the Pfizer booster to help in the fight against COVID-19 infection. I took it in the main cause of not being hospitalized severely or for a lengthy period. I implore all of you watching this video to get vaccinated. If you are vaccinated, get the booster. We all want to protect our loved ones and protect our close friends and family.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Everything has been running smoothly since the beginning, and